Hello, and welcome to the SOAPe Platinum Plus video learning series. Today we're going to be covering the Examination tab, SOAPe Note tab, Assessment tab, and Notes and Letters. Now, once you've entered your patient into the system, the next step is probably going to be documenting the initial examination. So when we click on the Examination tab, we're taken by default to the initial examination, and you can see there's a follow-up and a final exam options as well. So what we're going to want to do is first select the patient from our list. Select OK. And you can see by default that the provider is already entered here. If you had multiple providers, you would just click this box right here and select the doctor that was performing the exam. And of course the date of service, which we are going to change to the 4th. Once you get this information entered, you're going to click the Continue button. And what you'll notice when you click the Continue button is all these tabs, which represent various sections of the exam, become active up here. So we're going to go from left to right and document various components of this patient's physical exam. And we'll start with the Physical and Vitals tab. And once we enter that information, we're going to move on to the Case History tab. Now, when you get to this tab, it gives you the option to specify what type of case. So we're going to specify motor vehicle. The date of onset is already entered for you. And at this point, you have two options. You can manually enter the patient's case history by this area by clicking inside of it and typing. And once you do that, the options below become unavailable. You'll see they become grayed out. So it's your choice whether you want to use the point and click drop down boxes to enter the patient's history or type it in manual. And you'll notice when you switch up different items, some of these options will no longer be available to you. So it depends on what's chosen as the type of case, what appears below. So we're going to manually enter something here. Okay, and once we enter the patient's history, the next tab is the Subjective Complaints tab. And this is the screen where we're going to document the patient's complaints. So the first tab is the region, location, frequency, and severity. Patient symptoms we can document here. Any factors that improve the patient's complaint can be documented in this area. And any factors which aggravate them we can document here. And we'll scroll down and we can actually enter a second complaint. Now there's two complaints available by default. If we needed to add additional complaints, we would just click this button right here and we could add as many complaints as we like to the patient's record. So once we've entered our subjective complaints, we're going to continue on with the Prior Complaints tab. And you have several options here. We're going to select the first option, that the patient denies a prior history of injury or complaints to the affected regions. Continuing on, we have a Medical and Social History tab where we can document patient's past medical history, family history, any allergies, surgeries. So we'll just add a few items in here. And what you'll notice is these new buttons above each section, and what these buttons are for, if you click on them, it'll allow you to add additional items to these databases, these drop-down menus. And once we've documented this information, we're going to continue on to the inspection screen. In here you can document any visual abnormalities that you may note, any changes in the patient's posture and their gait, and if you wanted to add any additional comments, they would appear here. So you could comment on the patient's posture more, or any difficulties that you may have documented with their ambulation in this area here. Continuing on, we have the palpation screen, and this chart was designed to conform to the new Medicare Part guidelines. You can see on the left here we have pain, asymmetry, range of motion, and tension, which is the part system. And then we also can document trigger point or any edema that's noted. And we start from the occiput and we can work our way down to the coccyx. So we're going to document some areas of pain that the patient may have complained about. And it's just point and click. Asymmetry. And abnormal range of motion. This would apply to segmental motion. And if there was any tension noted. And trigger points. And we could also note some edema. And once again, if there's any comments you would like to add on your palpatory exam, you could do so in this box here. Maybe there's another area of the patient that you were examining, such as a shoulder, a knee. You could add any type of findings in here. Continuing on, we have the range of motion tab, and the first thing we're going to do is select our method of assessment. And you'll notice on the left hand side we have the varying degrees of motion, and this is the normal values that appear next to them. So we're going to select the range, and then we can associate if there's any pain with that as well. And once we have this documented, we're going to move on to the Orthopedic Exam tab. And these are categorized by the spinal areas, regions. So we're going to enter a few cervical tests that we may have performed. Now notice that this is checked off by default, this include descriptions, and this is useful. We highly suggest that you leave that checked off, because most of the people that will probably be reading your report will not have a good idea as to what these tests are, how they're performed, or what their findings represent. So leaving this checked off, it's going to help them to understand each test and the significance of the test. So we'll just document a few of these. And if you scroll down, you'll see all the other regions here. And at the very bottom, you can actually add your own tests. So if there's something that you commonly do in your office that doesn't appear in the screen that we have here, you can pretty much type in your own test here and then select the finding and add any additional comments that you would like there as well. So that would be the area to do that. Moving on, we have the neurological exam. As you can see on this screen, you can document any abnormalities in cranial nerves. The spinal exam, including sensory, motor, and reflex, and any special exams that you may have performed, and dynamometer exam as well. And this is nice because it actually will calculate the difference, loss of strength in the hand. And we'll skip the neurological exams up here, and we'll just enter some data for this to show you. And what you can see here is that it averaged out these readings between the three for both sides, and it calculated that there was a loss of strength in the hand here, the left hand, and this considers a 10% normal difference between the dominant hand already. So that's a real nice feature if you want to document a loss of strength. Now, keep in mind that you don't have to fill in every single tab here. Some doctors may not perform a neurological exam. If that's the case, you can just skip over this tab, ignore it. But the option's there for you. So continuing on, we have the Diagnostic Studies tab. We're going to just select a test, region, and we can document a series for this. And there's several impressions available here by default. So we'll just scroll down and we'll add a finding. And we'll add one additional one. Let's see here. And there are 4 impressions by default. If you needed to add an extra 1, 2, 3, you would just click this button and you could add as many as you wanted. And if there's any comments that you'd like to add to the diagnostic study, you would do so in this box right here. Okay, moving on is the assessment tab, and we're going to form or document our diagnosis on this screen. So we have a list of ICD-9 codes to choose from. What we're going to do is search the cervical codes, and keep in mind there's 5 pages here of codes, so you may have to scroll through to find the code you're looking for. And once you add it, it appears up in the code selection region. And we'll add another code. And there you go. You can remove these simply by tapping or clicking on this remove button and adding a new one, or just, completely removing it. Down here, you're going to have the patient's prognosis. And that's it for that screen. Next tab is the plan of care. So we're going to recommend chiropractic treatments, maybe some modalities and therapeutic activities for this patient. The frequency of treatment, we're going to put at 3 times weekly for 1 month. And then if you want to document any additional recommendations, we can do so here. And if you're planning on referring the patient out for maybe some additional studies or to another provider, we can do so here. And once again, as always, there's an area at the bottom for any comments. If you want to elaborate further on the patient's plan of care, you can do so here. And finally, we're going to go to the treatment screen. And up here, we can document any adjustments that were done on the patient. You just simply pick a region of the spine, your technique that you used, any listing, and then scrolling down, you're going to notice the procedure codes as well, CPT codes. So we're going to document our treatment for this visit, and we're going to go into the exams and search, and new patient exam. So we'll click here, and you'll notice the second box that appears, and if you click on this, you can add any modifiers. add any at this point. And maybe we did an adjustment on the patient. Click search. We'll put some adjustments in there. And that's pretty much it. You can scroll down once again and enter any details regarding the patient's treatment if you want in this box. Maybe specify where, ultrasound was performed or for how long, and this information will be carried over from visit to visit automatically, so you really only need to enter it one time. And once we've completed the exam, we're just going to click this Create Report button, and once we do, it's going to ask us if we want to generate the bill automatically. For this demonstration, we're going to say no, and it's going to present us with a preview of the patient's exam that we just created. So we can scroll down, see that everything's neatly formatted. And it's very neatly organized. All the exams are documented, as well as the orthopedic tests, I should say, are documented with descriptions. Diagnostic studies and your assessment and diagnosis, as well as your recommended plan of care and today's treatment. Now, if you need to change anything, you can do so in the preview. So let's just add something. We can add something anywhere we need to in the report. And once we do that, we're going to go up here and click Save. And you'll get a confirmation that the report has been successfully saved. Okay, so the next tab we're going to go to is the SOAPe Note tab. And this is the tab you'll probably be using most of the time. And once again, we're going to select the patient from the list. The provider is entered by default. The date of service, we're going to do that the day after his initial. And down here, you'll notice that you can select which specific areas to include in your SOAPe note. So we're going to uncheck a few of these. And now only the ones that are checked are going to appear in this patient's SOAPe note. We'll hit continue. And you'll notice that these tabs are the only ones that become active. So let's say the patient came in the next day and said, the only change in my condition was my cervical pain went from a 6 to maybe a 5. Everything else is pretty much the same. We can click on the treatment tab and just remove the exam, and let's say we just did an adjustment on this patient, and then we hit the Create Report button. And now we've just created a note for the patient's visit, and it took us roughly about 10 or 15 seconds to do so. Now we can remove any items we don't want. We highlight and just delete these and look over the report. And this is a very detailed report that was created in, like I said, just about 10 or 15 seconds. Go up here and save the report. Once again, you'll get a confirmation. And that's pretty much all there is to creating SOAPe notes. Now, moving on, we have the Assessment tab. And this is the area where you can create outcome assessments for your patient. So we have several options here. We have the Roland-Morris questionnaire, Oswestry, and the Neck Disability Index. So we'll select the first one, and as always, we'll select our patient from the list, the date of service, and the provider is already entered by default. And you'll get a brief instruction here on how to take the test and what the findings represent. And we're just going to go down and check off a couple of these items. Of course, your patient would have done this already. And once we're done, we're just going to click the print report button down here. And you'll get a preview of the report. And this is a very nice report because it gives a complete explanation as to the significance of this test, instructions how to take the test, findings represented by a score here. And if your patient takes these, let's say once a month, it will actually improve. It will compare previous scores to current scores and give your patient, and people that may be reading this report, a indication of how your patient is progressing. So that would be that report. The Oswestry, they're all pretty much the same way. Once again, you would just select the patient, the date, and some of these, obviously, you pick one from each section, so it only allows you to select one. So we'll just go down and select a few items. And once we're done, we're going to once again click the print report button. And we have a preview generated. And just like the last report, we have a nice explanation, instructions as to how the test is taken. We have the findings that are documented and scoring at the bottom here. So once again, it's a great way to document your patient's progress, and the score is up here at the top. So this patient scored 28%, and that would put them right into moderate disability. And you could give these tests every couple weeks to your patients. Finally, we have the Notes and Letters tab here, and once you click on that, you'll notice there's a variety of notes and letters that you can create here. We have birthday greetings, welcome letters, referral letters to physicians that may send you patients, attorney referrals, patient referrals, school excuses, and work excuse as well. So we'll do a birthday greeting, and all we need to do is select the patient from the list and hit generate document. And just like that, you have a very nice birthday greeting. And you can actually save this and email it to the patient, or you can print it out by clicking here and just hand it to the patient, whatever your preference is. These are nice here, the welcome letter, same thing. Select the patient and hit generate. And this is a great letter because it not only shows your appreciation for the patient choosing to treat at your office, but it actually encourages them to refer other people to your office. So these are nice to give out during the first visit. Click Save. And like I said, we can scroll through, and there's several other letters as well. And that pretty much covers the Notes and Letters tab. There's templates that you could actually create on your own, but we'll go into those during another lesson. For now, these are probably the main notes and letters that you'll be working with. And that concludes this video learning lesson.